I am Dr. Shyam Sunder from Aster RV Hospital. Having discussed about the causes of hypertension, next would be what are the diagnostic modalities involved and how to manage these complications, how to prevent the blood pressure. So usually in the early stages, when you go for the symptoms, if you look for symptoms, as we already said, it's usually a asymptomatic disease, means they do not have any complaint of any symptoms. Or sometimes a few patients will have a typical headache, which is usually situated back of the head, and it's usually in the early morning headache. So this is usually related to the high blood pressure. Or sometimes they complain of palpitations, increase in the heartbeat, or dizziness, or some ringing sensation in the ears, or sometimes bleeding in the nose, or vague fatigue. These are the common symptoms in whoever presents with the hypertension. Sometimes they can come to us directly with the symptoms related to the complications. So that is, if heart is involved, they come with a chest pain or heart attack, then only hypertension is diagnosed. Or sometimes visual disturbances, where when you look at the retina, you see the hypertensive changes. Or sometimes on routine follow-up, when the creatinine or kidney function is deteriorating or abnormal, then the hypertension will be diagnosed. Like this. Sometimes they come with the symptoms related to the complications. So this is almost very late stages of high blood pressure. But in majority of the patients, they are usually diagnosed during routine medical examinations, where they have annual checkups, where we pick up the high blood pressure, or if they go to hospital for some other ailment, then the hypertension is picked up. This is how the hypertension is diagnosed. Then, do we have any tests to detect hypertension? So usually hypertension is detected by checking the blood pressure by sphygmomanometer. In those patients who have a high blood pressure, we also look for any target organ involvement. Like for example, if we are looking for the heart, we also check for the ECG and echocardiogram. And when we are looking for the involvement of the brain and the retina, we ask for a ophthal examination or fundus examination, we call it. Then if you are looking for the kidney involvement, renal function test. So that's how some of the tests which are related to the end organ damage are looked into. These are some of the tests usually done for in a high blood pressure patient. Coming to the most important, how do we prevent this blood pressure? As we already discussed, 90% of this hypertension is related to lifestyle disease. Then the factors or important measures would be diet. Diet, again, important thing is you have to plant-based diet involving more fruits, vegetables, nuts, and reduce the saturated fats and trans fats also to be reduced, and increase your fiber content in the food by incorporating oats and legumes, beans and all, that type of foods. Second thing is exercise. Exercise, again, aerobic exercise, minimum requirement or minimum thing to is at least 1.5 to 2 hours per week of aerobic activity will be able to suffice. In addition to that, if you incorporate muscle strengthening activities like weights and also will be helpful. Exercise alone can reduce the blood pressure by around 6 to 8 millimeters of systolic blood pressure. Third thing is weight management. So obesity is also one of the important problem where the hypertension they usually coexist. So optimizing your weight or weight loss also one of the important thing to prevent the development of high blood pressure. Fourth is again stress management. So nowadays stress is, even though there is weight, exercise and food all taken care of, stress management, many patients are not able to look into that aspect, which again is by yoga, meditation and mindfulness. So, these are the things which can help you to reduce your stress levels. Then coming back to other factors like smoking. Smoking is completely no. You should quit smoking, stop smoking. Smoking itself is a risk factor for heart attacks in young people, and also it can increase the systolic blood pressure. And coming to the alcohol, alcohol also is a bad, but acceptable limits are 1 peg for a females and 2 pegs for a male are usually acceptable levels of alcohol per day for hypertension. Coming to the treatment, so sticking to the medical prescriptions or compliance is also very important. And if you are given medications, you have to stick to that. And then many times people ask how long is it going to be a permanent thing, whether I will be for lifelong medicines for once you start the medication. Many patients, if they are in the early stages, they may be able to either quit or to reduce the dosages of medicines, provided other factors are taken care of. Like for example, if you have reduced weight, if somebody is taking a balanced diet, optimal nutrition, or if stress management is under control, if all these factors are done, yes, they will be able to reduce medicines or they will be able to stop also. But in a late stages of hypertension, where the systems are involved, like a heart is involved, kidney or brain is involved, you have to be on medicines permanently. So we in our hospital, our Aster RV, many patients do come to us, and some of the patients in late stages with severe hypertension leading to sudden heart attacks or hypertensive heart failure, they do visit us and they are given prompt treatment and they are taken care of.